Hey Cam followers! I am very excited today because I have the lovely Diane Messum here, and we are going to be talking about things that are really very applicable to every owner of every arthritic dog. So yesterday we were chatting with Andrew Armitage about stem cells and some regen, and that really is only for some people for financial reasons, access reasons, but this today applies to everybody, so get your ears on and start listening in. So this is the lovely Diane. She's going to introduce herself. She works for a very, very well-respected referral centre in the UK called Davies Veterinary Specialists. Tell us a bit about yourself, please, Diane.
Oh gosh, I've been a vet physio now for 13 years. But yeah, I started out as a human physio back in 2002. Did my rotations in London, decided I wanted to specialise in outpatients and hand therapy, which lent me into the field of splints, orthotics, soft supports, which I now use on small animals, and we'll cover that a bit later. And then I did my MSc at the Royal Veterinary College, finishing in 2007, and since been doing veterinary physio. And I specialised solely in vet physio when I had my children back in 2012. I decided that I was just going to stick with the animals. They're easier to deal with. So, yeah. But now, since 2011, I've been at Davies Veterinary Specialists, and we were very fortunate to have the opportunity to set up the Therapy Fitness Centre, which opened just over 3 years ago. And we have a great setup here. We've got our consult rooms, a gym, a hydro suite, and a great team of specialists around us, and nurses and client care, and we've got great support from everyone, and it
is beautiful. I was lucky enough to go to one of your owner workshops, and it is a fantastic facility, and something that really hits you as you walk in is that you mean business, you're taking this seriously, this is an important part of healthcare, and you're not going to cut corners. You know, this is important input into that dog's life, and I just loved it. So just looking in the background, you can see already that Diane is equipped. So there you go. I'm sat on the floor. So let's crack on. From a physio perspective, let's start talking about arthritis, because I think there's a very, very big thought process of arthritis pain. And people don't think about the bigger picture of the joint, the mechanics, the changes that come with it. So just take us on a journey so that people can keep up with us later when we talk about interventions. Tell us about arthritis.
So arthritis from diagnosis, it can involve many structures of the joint itself, the synovial joint. So you've got your articular cartilage, you've got your subchondral bone, your ligaments and soft tissues surrounding it, your synovial membrane. And I think as well as pain relief, which obviously work with the team to manage that, obviously the soft tissues really are important that surround these synovial joints, because as soon as they become weak, and they become weak because there's pain present, then you're losing the biomechanical or the biological scaffold of the joint itself. So the stronger the joint is, the less forces that are going through it. You can minimize pain as a result of that. And so, yeah, so that's where, from a physio point of view, it's really important. And you know, you're with problems arising in the synovial joint, you're getting pain, as I've already mentioned. You get reduction in function. You can get swelling and heat, when there's an inflammatory process going on. You get joint instability if there's loss of muscle strength. You're getting...
I think that was something that I really didn't get. So one of the reasons that I think people are beginning to enjoy CAM is because the person that set it up was quite stupid. And they can follow her pathway, because she didn't realise how complex OA was until she started looking into it. That's me. And I really didn't realise about joint instability. I didn't realise about joint capsule thickening, and I didn't understand about the loss of proprioception, and I really had, as a vet, knuckled it down to cartilage damage, swelling, changes in the synovial fluid, so not ability to cope with concussional forces, restricted movement, but that was as far as I went, and therefore I was very content just prescribing anti-inflammatories, supplements and further pain relief, because I didn't respect like all the biological changes that were happening. happening. So if you're happy to just play here a little bit, let's get the public understanding about what's happening in that joint. Go for it, you know, amaze them at how complex it is to a degree.
Well, you've got the proprioceptors, which are the joint position sensors. And they also, they responsible for your awareness of where your limb is in space, essentially. So you need to have good proprioception of a joint to minimize risk of damage. So I think that's really important. And that, again, boils down to proprioceptors within all of the soft tissues surrounding that joint as well, the muscles, the ligaments, and the mechanoreceptors within the joint as well. And so we have really got to make sure that we address all of those issues with our exercise. And I guess I'm going off on a tangent really slightly, Hannah, and apologise, but a lot of the stuff we're doing is already being done in the human field. And if you look at the NICE guidelines, which is the National Institute of Clinical Health and Care in England, or Clinical Excellence as it might previously been called, the core things that we need to address with these osteoarthritic cases are education, and really making sure that you're educating the owner or the patient in a human field, obviously, with the right information, get them on board, get them understanding and really understanding the condition, because once you've got them on board, they become more self-empowered to take on further advice on what they can do at home. So that's one. The second one is weight loss, and I know that's been addressed on countless occasions, and we can touch upon that a little again later. And then exercise, and it's so important. And exercise can include land-based exercise and hydrotherapies as well, which we can talk about a little later. So we're addressing all of those things. I think all those things are accessible for everybody. We can do all those three things. We don't need a big pot of money to be able to provide those things. You know, it's just finding one person on one occasion to maybe get the correct advice. They can assess your pet, look at the needs for your pet, look at the problems, say, okay, we're going to address each of these problems with this treatment plan, and you can go away with there as often as you need us, and we can provide what you need from us. And then I'm always at the end of an email or the end of the phone. And
that's something that I think people really, really underestimate, is that referral centres tend to have a little bit of a moat, imaginary moat around them that people perceive. And you're only allowed to go to a referral centre when the drawbridge comes down and they invite you in. And it's so far from the truth in that I regularly can phone referral centres and speak to people that, you know, they really know their stuff about that particular area. So any vets, nurses, therapists that are listening, do not be shy, because the lovely people like Diane are willing to, you know, take your calls, take your emails, and help you fathom out how to make that case improve. Just going back a little bit more, because I just want to really, really anchor down the importance of looking at the bigger picture. I'm going to tell you a little story about how I suddenly had the penny drop about where physio, rehab, therapeutic exercise, other interventions come in. I was looking at an old Labrador, and it was in someone's house, and I'd been doing a house visit as a vet, and the dog was walking across the slippery floor, and it slipped. And I was thinking, why? If it was painful, if it was just joint pain, it should be like toe touchy, and it should be walking on hot coals. But this dog was wobbly, and its leg was placed badly, and then it slipped. And I think, you know, that was when I started thinking, nah, it's not just about pain. There's something else going on. And that sounds so daft, but vets really don't get taught the physiotherapeutic viewpoint. That dog didn't really know where its leg was, because it was only getting a pixelated amount of information, because its joint wasn't moving properly. It had soft tissue wastage, so the muscles had wasted. You know, there was less information getting to that dog's brain about where its leg was because of the change. And then that led to it slipping, which twisted the tissue, which inflamed the joint, which made it worse. And that kept going on day after day after day. And it's only because I saw that wobble and that slip and started going, that's not what pain does. Pain makes you ouch and tenterhooks. So guys, I hope that helps a little bit for people kind of going, I don't understand. It's a big picture with lots of tissues involved.
And if I can add to that, Hannah, as well, pain will cause muscle inhibition. So when you've got pain in your joint, you don't want to move that joint, and those muscles will atrophy as a result. They waste away, they don't support the joint, and that's when you're getting your instability and your reduced proprioception as well. So hence why exercise is so important, but it's looking at how we can address that with the appropriate pharmaceuticals, the right drugs on board, before you go down that line, which you might need to do for a lot of our pets with osteoarthritis. So
explain that further for people, because there's a lot of people out there that are really scared about drugs. They're really scared, and they would much rather go immediately to a hydrotherapy pool. They'd much rather immediately go and start doing some exercises. Why is that not a good idea if the dog is painful?
You're going to get bad movement patterns occurring. So if you've got painful joints, you learn to move in a way that's going to avoid loading that joint in the way that it doesn't like, essentially. So as a result, and I've heard Andy talk about it previously, you're getting compensation issues arising. So you've got overactivity in other soft tissues in the body. You know, if it's, for example, if it's an elbow arthritis, arthritic joint, you're going to get a lot of trigger points and overactivity in the structures higher up around the shoulder, behind the shoulder blade, up through the rhomboids, which is just behind the neck, and you're going to have pain as a result of that as well. So we've got to address all of those issues. And I've gone off tangent.
No, not. It's really important that people understand that, because one thing that's happened on Holly's Army a few times, so everybody, Holly's Army is our community group. The honest truth is that we want to create an emotional as well as an educational support group for you guys. So it's not all about fact, it's also about care, and we want people to know that they're in a caring environment. But also another reason is that there's only a finite number of CAM team members, and we're now trying to cater for 4,000 people. So we're now hoping that you guys educate the next. So it's a beautiful place. But in Holly's Army, there's a lot of people that are, as I say, scared of medication, and they want to go straight into an intervention, and they don't understand why a kind of softly approach is better. And what's great about it, guys, all of you that are scared about long-term meds, this is a perfect opportunity to demonstrate it's a short-term pharmaceutical to get an intervention in, to maybe come off of the pharmaceutical and move forward. So all these people that believe we only dispense non-steroidals for life, it's wrong. We have a plan. It's just you've got to get on board our train to do it.
So you brought me back, Hannah, and if I can just continue for a second. So we need to get that pain relief on board to make sure that we can get the muscles recruited correctly, because I think if you've got that pain relief, you can recruit the muscles correctly, you can get them stronger again. The strength will help support the joint. Hopefully you'll get reduced pain, and then, as you said, you can withdraw the medication hopefully at that stage. So it's not, it's not a negative thing going on medication. It's a really important part of our treatment and our end goals. So yes, and I think exercise, there's a phenomenon of exercise-induced hypoalgesia exists, and that means exercise reduces pain, and we don't really understand it yet. There needs to be some further work done on it, but we know that exists, and I think that's partly why we see improvements, and exercise is so important for these osteoarthritic patients.
Yeah, absolutely. And I just love the fact that you can really simplify it down and take out all the scary stuff and say we need to get them moving, because if they're moving, then they start going up the positive spiral, not down the negative spiral. So if we can do everything to get them moving, then other things can come into play. Just so people can understand something else that I think features quite a lot on Holly's Army is that somebody recently was on there and they were saying that their dog had quite severe arthritis, but it was okay because he wasn't in pain. And I struggle with that quite a lot, because generally, the dogs that we're seeing that have arthritis will have not only disease around the joint, but they will have secondaries. They will have compensatory changes. They'll have movement pattern changes, etc. And, that is going to be a degree of discomfort. Now, one of the things that people don't realise is dogs have got amazing coping mechanisms, and we have coping mechanisms. And the muscular system can cope with this weight shifting, different movement, and then it gets to the ability, it goes, I can't cope anymore. Would you say that's fair to say? So do a lot of the cases that come to see you, they've got to a point where they've stacked up quite a few problems?
Yeah, we have, yes, they've stacked up a few problems. They've gone through a number of medications. They've tried a number of things from their local vet, and they've been referred into our orthopaedic service, perhaps for assessment and consultation. And I don't know, Louise touched on it last time. We have a pain management team here, and myself and Sarah, my colleague, a physio colleague, we work closely with Louise and her team as well. So we get our patients into the pain management team. We see a case for an hour and a half. So we have 90 minutes with them. And during that time, obviously this is huge, amount of time in comparison to the referring vets, who unfortunately can only, manage 10 minutes. And that's just the way the vet service runs until you, perhaps can access a specialist service. But we have them in for 90 minutes. We take a full history, including everything that's been tried before. We then will do, I'll talk to them about their home situation. So whilst we're not physios that go into the home here, unfortunately, where we would get a good idea of how the setup is and make suggestions, we rely on the information from the owner. So we're asking lots of questions about how the home is set up, what's the flooring like, what's your stairs access, what's access to outside, and we sort of take all that on board and try to build a bigger picture of what that pet's doing on a day-to-day basis. So we've got that, and then we do our assessment. So Louise or a team will do a health check to make sure that there's nothing concerning that might affect her advice regarding pharmaceuticals. And then we'll do a gait analysis. Then we'll look at the movement patterns. We'll look at their transfers, their postures in standing and sitting. And we'll do a full head to tail check. We'll look at every single part of that body to try and identify not only the primary problem, looking at the joint that they, that's mainly the problem, but also looking at where there's other issues arising, secondary effects as well. So yeah, and
I think it's lovely to think like that. I think public, listen to this is quite good. Primary problem, secondary problem, potentially tertiary problem is a very good way at unraveling your situation. So primary problem might be the hip arthritis, secondary problem might be trigger points and shoulder tendinopathy where they've weight shifted, and tertiary problem might be behavioural change and weight gain. Can you see how there's this progression of this disease? So anybody that tells me arthritis is boring, no, it's fascinating and we can do so much for it. But you, as I say, you spend time looking at the tertiary, looking at the secondary, looking at the primary, don't you? And bring the picture together.
Because once we've got all that information, we can sit down with the owners and we say, okay, we have all this information now and we've got all of these options available to us. Which ones are going to suit you and your circumstances? And we recommend these suit your pet, because it's all individualized. It's really important to drill that message home. Everything is tailored to that patient that we have in front of them. Not every patient is the same. So we have to really be specific in what we offer each and individual patient. And that comes down to the pharmaceuticals, the exercises we're delivering, what they need to do at home to make changes. So yeah, so we once we've done our assessment, we will then come together, we'll have that chat, that discussion, and we'll say, okay, who's going to lead the treatment going forward? What does this dog need? Is it going to be a physio-led treatment plan? Is it going to be an anaesthesia-led treatment plan, which might include acupuncture as well? Or is it going to be a combination of both and hydro as well? So we have a number of cases that we do a combination of acupuncture followed by hydrotherapy, because we find the additional relief they get through the acupuncture, and we're if there's a lot of myofascial tightness and overactivity in soft tissues, we can release that before we then get them into the water where they're supported. And we can try and correct those movement patterns and get them moving in a better way, in the way that they should.
Yeah.
So I hope that makes sense.
Oh, I love that. I was really lucky. I'm going to give her a little big up now. I had my absolutely adorable friend Danny come and stay with me up in Scotland last week. And she works very much in the treadmill. So she is in the tank. And she's combining her postural work, her massage, her myofascial with the water, with the treadmill, and bringing together everything. And it's so fantastic to watch. So, get all flustered. Right, so let's now go on to, do you want to go on to your specialist topic? Because this is where you're going to get quite happy place, isn't it?
Well,
Come on, do it. Let's talk about orthotics, because there's not going to be anybody else that has the understanding that you do. So let's talk about them.
Well, I think we can look at what we can offer outside the box, really. And as I mentioned before, I have quite extensive experience of doing hands in the people industry. So I was, I used to make splints and soft supports for hands. And I was very fortunate when I came to Davies to be able to use that skill and apply it to our small animals. I had a fantastic support from the orthopaedic team, and we have developed that service extensively since. So I now, we make custom-made neoprene and thermoplastic splints on site, and then we can also cast for more robust orthotics. So that requires sending a cast impression of your dog's limb off to a company overseas and then getting an orthosis back. So I guess the question is, there's different grades of orthotics, from the neoprene right the way through to the more robust option. And here's an example of a more robust option. So it's a more rigid design and it's built to last. But for our osteoarthritic cases, this probably isn't so appropriate. And so you might be looking at something like a neoprene sleeve. And, I think the question is, I remember when I was treating people still, I've sat on the fence a little bit when it came to knee sleeves and whether, knee supports are appropriate for management in knee osteoarthritis. In my head, I thought, well, actually, the muscular support system should really be supporting that joint, not a support, a neoprene support as such. But I think it's really, I think what we need to take home is that you're just maximising your return on investment when you're exercising in a gym setting or at home or whatever setting you are with your pet. So if that knee or any other joint in the body feels more comfortable and you can exercise more efficiently with that comfortable joint, then you're not using it as a crutch. It's fine to use that in the beginning, and then you can hopefully withdraw the need for that later on once you've built up that muscular support. So, okay, you've got your knee support, your pain is better controlled, or you feel better because of that knee support, or I'm referring to as a knee support, but neoprene support. And then you feel better, so you exercise better, you strengthen your muscles more successfully, and your muscles are strong, so your knee is more supported, you reduce pain overall, and so you can then withdraw that knee support. So
which is great, because I think, first of all, just really clarify, because a lot of people that will see orthotics, supports, whatever you want to see them, call them, they might see them online, they might see them in a shop. More than likely, they go on their iPad 11 o'clock at night, and they suddenly find carpal supports or elbow support or something. And they're going to really think that they're offloading that joint. So the human brain, my brain originally was, oh, pain when placing weight for it and bending it and twisting it, pain. So I just need to stop it moving and I need to stop the weight going through the joint, and then the pain will go and the dog's going to be happier. No.
That's why most of the support's appropriate for osteoarthritis. If you are going to use a neoprene wrap or support, it is a soft one, something that's flexible, that still allows the joint to move. Sorry, I'm trying to find the camera here. And that's an example of a little small neoprene tarsal support. And you can reinforce them with Velcro straps. So I could attach a piece of sticky Velcro onto it. Sorry, Hannah, I'm not looking at the camera. So you've got the Velcro, and you can attach that to reduce the give in the neoprene if you needed that little bit more stiffness support, just to give the joint a little bit of rest, especially with a dog that you can't say you need to just back off a little bit, you're overdoing things. That may help, but I think it needs to be done carefully and with the advice of somebody that has dealt with it and knows what they're
because you can actually make things worse, couldn't you? So just explain what that means. So for people that go, I'm just going to go and buy a wrist support for my dog.
So if it's a rigid one, you're immobilizing the joint, so the joint's going to become stiff. Osteoarthritis in joints don't like rest and long periods of immobilization. They need to be kept mobile little and often, which is why we recommend little and often exercise when you're walking your dogs out. So if you're stiffening that joint up more by applying a carpal support or a tarsal support, then your joint's not moving, it gets stiff, the muscles aren't functioning fully, so you're going to get muscle weakness, muscle atrophy, and then you're really you're going back to square one almost. So you've really got to do it in a careful way and with the right advice. So I would just recall.
And also, dogs all come in different shapes and sizes, and we we were looking at putting supports into the cam shop. Maybe they will go into the cam shop as we try and grow it. But we had a big chat. Mel Bruder's on the team, you know Mel.
Yeah.
And we were like, is this actually dangerous? You know, because we could have an owner that's buying the wrong size carpal support and putting one that's way too small on a big dog and vice versa, and it could actually be hazardous. And at that time, we decided, no, our absolute promise is not to make things worse.
Yeah.
So be really careful, guys. You know, if you do want to go down that road, then please seek out somebody that's got more experience and accept it in the price of the product. You know, if you're going to buy the product, accept there is an additional fee to make sure you're using the right product. You don't want to do further harm, do you?
No, all ours are made to measure, so we know that's fitted personally to that dog that's in front of you. So, and there's some great wraps in the market. And I think just go to somebody that knows them well and can advise you on the right one if you are going that route and you haven't got somebody local to you. I've started teaching other colleagues how to make soft supports and splints as well, because you know, I was getting inundated with lots of inquiries, requests, advice from colleagues saying, I've got this patient, what would you recommend? You know, can I make something? And so I thought, when I got so many, I thought, well, I'm one.
Of your next course. I'm coming.
So yeah, so I'm a bit like Cam team. I'm trying to, you know.
Yeah, well, let us know, because if there's anything we can do to help, like get people on your course and more people understand it. Perfect. And another thing to remember, guys, is that you can't just put a support on and jobs are done. And you know, you can get sores, you can get rubs, you have some dogs that really just don't want to wear them. So do take support. Don't get on eBay now and just go and buy something and think it's going to be okay. Before we go into more detail about supports, there's just a couple of questions. Would they help with OA and the hock? Would they help with digital OA? Can you kind of suggest yes or no? I know not every case is the same.
I think regarding the hock, I think it goes back to this description the one I was trying to explain earlier about the knee. I think if you've got painful hock and it makes them walk better, more comfortably when you apply a support and it helps you execute those exercises in the early stages, I think yes, fine. But long term, it would be nice to try and withdraw from that. But yeah, I think work with somebody who can recognize that with you, alongside of you. Going to the digital OA, so you can modify boots. So you can buy lots of boots. There's different types of boots on the market, and there's a couple that I kind of stick to. But
you can't recommend them. That's cool. It's not like you're not getting kickback.
I mean, I tend to go for the rough wear ones. I like the rough wear boots. Because so I like the design because they shape well, they fit most breeds well, and I can modify them quite nicely. So, you know, if I've got a dog that's referred to me and it's got digital OA, it might have quite a large drift. So I don't know whether the camera's picking up, but you can get a drift in the digits, and I've seen drifts where they drift laterally quite a lot, and that might be as a consequence from other problems further up the limb as well. And they're quite painful, and the pain might be, be from the digits itself. So what can we do to try and help the pain in the digits? Well, what we need to do is try and see if we can reduce the load on the outside of the digits by realigning them. So what we want to try and do is bring those digits back into a neutral alignment. And I'm a prime example. I've got a terrible bunion, and I'm not afraid to own up to that. But so I'm a runner, and I've just got the most awful running gait. So it's terrible. But I wear soft supports. After 40 years, I finally succumbed, and I now wear supports in my foot. But so I'm doing the same for the dogs though, because I've mocked this up because I didn't have one to hand easily, but so it's a bit bigger than I would normally, but I just wanted to use it to demonstrate. So basically, if you've got that drift just here, what I'm trying to do is realign, but what's happening is the inside joint has dropped quite a lot, and so you want to try and see if you can support that joint, and if you can support the joints more on the inside with a medial wedge, as you might call it, you can hopefully improve the alignment of those digits and reduce the pain as well. So having something that can be inserted into a boot, and that's when you need to size up correctly, because if you're going to put an insert in, you need to make sure that it's done appropriately. Then hopefully you can get that foot in a better alignment, and that dog's going to be more comfortable because there's less load and forces on the outside of those joints, which they will otherwise be in that position. Does that make sense?
I think that's amazing, and I find that so exciting, and I want to come on your course. I really want CAM followers not to start squeezing their dog's feet into shoes to try and protect them. That could be a disaster.
There's so there's boots which are your cheaper form of devices that you can look at getting, and even if you haven't got dogs with drift, but they've got digital OA and it's uncomfortable, having a boot just has that cushioning in the bottom in the sole, which just means that they're not weight bearing on those uneven surfaces. They're a bit uncomfortable on like stony, gravelly surfaces. So it can make a huge difference. But for some cases, there's been a couple of cases we've cast a limb to get these little orthotics as well. And this is just a paw or digit sort of distal limb orthotic. And again, this is more robust but can improve the alignment. I had a patient that whose owner tried all sorts of boots, and we tried modifying a boot in the beginning, but he just felt it wasn't quite right. And we were fortunate to have the company that provide these over in the UK and come and visit. So he was here to see the patient with me as well. And the owner was super keen to get one of these and is doing well. The dog had a digit amputated, so it added to its complex issues. So we had to try and see if we can realign the digits. So I just created a little bit of it was like a memory foam wedge between the digits, so we could improve the alignment of the other digits within this. So that's your more robust option, but hopefully most dogs won't need anything like that, and probably can cope well with the boots, which
just shows you that there's so much more to it. So back to the point, guys, arthritis is not boring. A question here: can those supports inserts be used to help alignment for dogs who have Queen Anne legs due to bad breeding?
Oh, so your Queen Anne legs are really coming from your elbow and your carpal problems. So I think you need to address the proximal joints.
You can actually make it much more uncomfortable because you're kind of fighting a bad tide there.
Yeah, so I think you need something that includes the carpus if you're going down a non-invasive route. So potentially, I'm without seeing the case, it's difficult for me to comment, but potentially you might need something that's rigid. Let me see if I've got something.
She digs out from her box of tricks.
Well, I try to have everything on her. It's a bit robust. This is for soft tissue injury because it's got the motion limiting devices on the back here. But basically, it's a carpal support which would go all the way down, and then you'd have a foot segment. So you'd need something like that if it was a non-invasive route and they were getting pain from the carpus. But if it's pain from the elbow joint, I'd recommend an orthopedic assessment before any decision.
Yeah, and that's the thing with these. It's hard to kind of help people because sometimes we feel like we're giving people ideas and then they have difficulty accessing, putting them into action. And I think with orthotics, a really big take-home message is, yes, they're out there, and ask your vets and ask your vet physios, but be careful about going it alone. Like, I really haven't got enough experience in them, and I've been a vet for 19 years now, and I'm really passionate about what I do, and I'm learning as quick as I can. But I wouldn't go there. I would be seeking the support of someone like Mel Bruder, who's in the team, or Diane, to get the right answers. Another thing to just talk about as well is boots. Now, boots. I have a problem with a lot of them because they end up just adding weight and dysfunction and cumbersome to a lot of dogs. And I have seen owners that will buy boots with the best intention and they'll put them on, but they don't have the ability to see that they're actually making the situation potentially worse. Do you experience that, especially with the digital OA, where they've bought a boot and it's actually really bulky and they're beginning to trip hazard it and it's changing the way they walk and it's making something else worse? Have you seen that?
Yeah, well, not too many times, I guess. I'm lucky not to have seen it many times. Usually it's the other way around. They haven't even explored that avenue yet. So it's usually advising them from day one, which is a better place to be, I realise. But yes, I think on occasions we've had owners that have bought every boot on the market and tried everything and not really found the one that best suits their pet, and see whether it's making that pet move better or worse. So yeah.
Still need advice. It's where the physios are good. This is where they're trained to look at function and movement, and they can help you make the right decisions. Can we just step back a little bit and talk about the hock support or the carpal support, and talk about how they can be making that dog feel more comfortable, so more willing to exercise, so more willing to actually get the strengthening, the stamina, the stability. Are you happy to talk about like the proprioception, the pain gate, the warmth, all of this sort of stuff, so people get it's not about mechanical support?
Yeah, so I think the first term you described, proprioception, you're increased. It's like, I suppose I liken it to wearing a watch for the first time after a few months. When it feels really strange to you, and your wrist is more, you're more aware of something on your wrist. And I think that's the same thing that your pet is also getting when you're wearing a soft support. So you'll have that initially, and some pets, when they're first fitted with something like this, might look like their legs are going to drop off and their foot's off the ground, like, what on earth have you put on my leg? I can't possibly walk with that. Yeah. I encourage owners to then just, say, just walk your pet a few times up and down, away from me and towards me, and that pet will be walking normally within, a few strides. But yeah, so proprioception is a big thing that you're enhancing. And again, if you're enhancing proprioception, you can improve muscular awareness and muscular strength on the back of that as well. So I guess that's where it's coming from. Again, the research in the human field is still limited, and obviously, you can imagine there's not really anything in the dog field. There's only
it's very limited.
The number of orthotic papers that I've managed to pull up, and one's on carpus for a neurological complaint, and then a couple of medical papers out
I think it's really interesting. The only reason I say that is that I really am quite stupid, and I am lucky. I have two brains. I have the stupid Hannah brain, and then I have the little brain at the back goes, no, Hannah, I don't quite think that's right. But the stupid brain would be like, oh, I've got to tie it on really tightly. I've got to put it on, and I've got to strap it on tight, and it's going to support the joints. And that's probably what my whole family would do. But actually, little is more, isn't it? In these situations, it's not about getting one with loads of Velcro.
No.
Tying it on really tightly. And a good story to tell you is about a lady that came in to see me today. She's lovely. She's so lovely. And she was doing lateral stabilisation of dog, dynamic stabilisation. And I was like, would you like to show me what you're doing? She was like, well, I shunt him across the room pretty much. I'm like, no. No. And I was like, oh, but I thought you wanted him to move. I thought you wanted to shift. And I was like, no, I want tiny micro movements, tiny little engagement, just little bounces. Less is more. And I think that's something to be really said about these supports. There is an element of less is more in that they're doing a lot. They don't need to be tight.
Yeah. Just that touch sensation is enough, And you said warmth as well. Yes, it's going to warm the joint. And again, warmth. We know warm therapy, hot heat therapy is comforting for osteoarthritic joints. So yeah, if you can provide that with a wrap as well, yeah, absolutely.
Yeah, I think it's a really exciting area, and I think non-pharmaceutical interventions are really wanted by the public. They're really wanted, and things like this is a really interesting area. So if there's any business people out there who are watching this, get in touch with Diane, because she's really onto something. What else would we like to talk about? We talked a bit about therapeutic exercise and how you wanted to kind of go into a bit more in depth than Andy did. So Andy Gardner, please go and look. Andy was hilarious because his phone kept slipping down and he had to keep popping it up, and he had his own disco because the light kept turning off, so he had to keep turning his light on. But it's really worth watching because he's a lovely guy and he's coming back. But he talked about therapeutic exercise but didn't give a bit more depth.
Okay.
What it's all about.
So there's lots of work within the human field, and what we can take from that to apply to the veterinary industry is, there are parts of it which I'll touch upon. So, I mean, we've looked at the types of exercise and exercise prescription in, for example, human OA knee, osteoarthritic knee is a huge responder to exercise. And there's a Cochrane review, and basically the Cochrane review is basically a systematic review to identify and appraise lots of research papers in the market or out there that's been published to answer a specific question. So the Cochrane review looks at the use of exercise for management of osteoarthritis. So the review was last updated in 2014, and they picked 44 papers that met the eligibility criteria. And of those 44 papers that assessed pain and function, they showed there was moderate benefits in improving osteoarthritis pain and function. So they also looked at quality of life in 13 papers, and there was small benefits. So we know that exercise, and it sounds small and moderate, the words small and moderate don't sound very impressive, but actually when you look at everything else that we are using and trying with osteoarthritis, it far supersedes, lots of other interventions. And I think, I was a bit of a geek the other day, I was listening to a podcast on osteoarthritis, and there was,
you have to pass that on.
I'll forward it to you. But there was a lady that was talking about all the research papers out there, and she said by 2002 there was so much robust evidence for these, the importance of exercise for osteoarthritis joints. They said, actually, we've got so much powerful evidence now. We don't really need to do much more. Obviously, there is stuff still to be explored and researched. But just impressive that, 18 years ago, they already decided there was loads of evidence that said you've got to continue with it.
You've got to be moving.
Yeah, and there's different types of exercise, like I touched upon. So you've got your targeted specific strengthening exercise, and then you've also got your aerobic exercise, and your aerobic exercise can include your hydrotherapy, which, with resistance. So you're using the properties of water to exercise your pets. And I guess now would be a good time to touch upon the properties of water. So you're using your buoyancy to offload those joints to make them feel more comfortable. And you're using the viscosity and resistance of the water to then apply resistance to increase the challenge the muscles are under, so build strength. And so you can change the viscosity with the treadmill belt as well if you're in a water treadmill, so you're changing the speed. And then you've got temperature, which is very rigorously controlled. So most underwater treadmills or swimming pools will usually be between 28 to 32 degrees Celsius. So really nice temperature for those osteoarthritic joints. And if it was to drop below that, we wouldn't permit any of our osteoarthritis cases in the water. Hopefully doesn't happen. So there's and then the hydrostatic pressure as well. So if you've got a dog that's got reduced proprioception and it's a little bit more unstable, if you put them in the water environment, the hydrostatic pressure from the water actually stabilizes that dog much better, and you'll see an improvement in their gait. And there's a research been done on horses looking at experimentally induced carpal arthritis, and they put them in the underwater treadmill, and the outcome was that it improved postural stability quite significantly as well. So it's worth looking up for any professionals that are looking at this. I just remember the author off the top of my head. I'm sorry.
You can put it on the link. It's fine. Just send it to me and I'll put it in the thread below.
Okay. So that's quite interesting. I think, just because it was done on horses doesn't mean the same won't apply to our pets as well. So get them in the water. But, a lot of therapists out there work inside the tank and the water chamber, if it's a treadmill, with your pets as well, to optimize the position that they're working in, improve their stability if they need any additional support, stop that leg from placing itself outwards by facilitating a more sagittal plane. And I think Kay mentioned it's a bit like a robotic dog, but move that forward, backward plane rather than circumducting. Sorry, I'm out of camera. Circumducting the limb to avoid any, pain from loading in a certain way. So you want to try and see if you can recruit the muscles in a more forward, backward plane. So
underwater treadmill, I've only just started doing it. I absolutely love it. And I love having the ability to be in that environment where the dog is comfortable standing, and I can take my time and I can work my way around. And yeah, and also the water kind of magnifies if there's a problem, so it's much easier for you to kind of start seeing things. So any therapists out here, any nurses, any vets that find this area fascinating, go do some, because it will just blow your mind. It will really fuel your fire a lot more. But going back to therapeutic exercise, so we abbreviate it to HTE, so home therapeutic exercise. And there is always a belief in owners that it is just a march to the park. No, it's march down to the post office. Exercise has become heavily linked with lead walking in park, or ball throwing, or, you know, glossy pictures of dog jumping ditch. Tell them about exercise. I mentioned earlier this lovely lady, and just very micro movements and how powerful they could be depending on the dog's day. Tell us about home targeted, you know, because a lot of people go, I can't do anything.
Well, what you're describing is going back to dynamic stability, and what we mean by that is the body's ability to prepare itself for certain movements. So if I was standing up now and I wanted to take a step forward, my body would have to prepare itself to take that movement forward, and that's where you need your core and dynamic stability to kick in. So what you're doing, those perturbations, is addressing any issue with weakness around that area, and that can come about through compensatory issues. If a dog's got hip pathology or stifle pathology and it's been holding itself through its back, it might you know, it might have pain around the back, and you need, and as a result it's not recruiting its core and dynamic stabilizers correctly. So you've got to go right back to the foundation, and then addressing the proximal stabilizers of the limb as well. So with those perturbations, you're getting the opposite limb to the pressure you're applying stabilizing and bracing itself as well. And then I progress further on from that by calling it stabilization. So I'll get the owner applying pressure and waiting for the pet to match the resistance. So it's bracing and holding, a little bit like what we call symmetric exercise, an ability for a muscle to contract without movement. And again, that's something else that's addressed in all these research papers, saying how powerful isometric exercises are for pain relief. So if your pet can't do sit to stand because it's too painful, then you can do something very simple like your rhythmic perturbations, or an advance or progression to the stabilizations, and get that muscle contracting without movement, which will be much more comfortable for the animal in the very beginning.
And owners can do this. This is what's so cool.
It just needs the right education, and you know, it takes a couple of times for the owner to really feel it. And I say you've just got to wait for the aha moment. And I'm taking that from Laurie Hughes, actually. I think it was.
Oh my gosh, she's on next week.
Big thumbs up for Laurie, so you've got to watch her. But yeah, so I wait for the aha moment and wait for that time where you get the owner matching your resistance, and it differs so much between pets. I had a lady yesterday I was teaching it to. It was a neurological dog, and I said, okay, try it from one direction and you'll feel a really strong resistance against you. Try it from the other direction. And she said, oh my gosh, he just wants to keep going. He just wasn't matching her resistance. It really highlighted the weakness, and I love it when that happens. As much, you know, as bad as it sounds, it just means the owner can then realize that they've still got weaknesses that they need to address, and so you're getting the owner on board more because they really understand
and I just love the fact that that owner's now stepping outside of the joint, which is a really, really important thing. I get just on a little rant, a little soapbox, I get frustrated that, you know, people say vets only prescribe non-steroidals and it's all about supplements and it's all just about joint. There is so much that is affordable, accessible, and hugely beneficial that has no side effects that we could be doing, but people aren't talking about it. You know, it's daft. So that's what CAM's about. CAM is about giving you access to things that you can do that are going to work, and there's evidence.
Yeah.
So this is where man is basically trying to promote the role of a good, well-trained, qualified, experienced physio into your plan. Would you say?
Yes, definitely. And I think, you know, I suppose moving on slightly when we talk about exercise prescription, and, you know, I'm guilty of it when I first started, and I probably still do at times for the right patients, but, you know, it was always do this 10 times and repeat it 3 sets of 10. You know, 3 times 10 is always the thing that everybody remembers. Why 10? Who picked the number 10 out of the cloud? But there's some research been done that looks at, it's difficult to extrapolate, but there's research been done by Capon, I think was the author, back in 2002, and they looked at looking at maximum repetition reps for basically 3 to 5 repetitions and the effects of that. They looked at 8 to 12 repetitions and the effects of that, and they looked at 20 repetitions and the effects of that. And it's very difficult because we can't do maximum repetition for our small animals. But what they found is when the highest strength gains was done when the repetition max was between 3 to 5 repetitions.
Oh, wow, that's achievable.
Yeah, it's achievable, but you've got to, you know, your maximum repetition means you're lifting the maximum weight or pressing the maximum weight if it's a person. That is possible. So by the end of your 5th one, you know, you can't do a next one. That's the idea behind maximum repetition. Right. So they found, I think it was over 60% strength gain, as opposed to the 8 to 12 and the high reps, the 20, was I think in the 30s. So quite a significant difference. But we can't apply that to our pets, and we can't apply it to our osteoarthritis pets. And so we might recommend 3 sets of 10 or 3 sets of 12, and that's fine if the pet can cope with it at that stage. I don't think it's a good idea to stay at that, though. It needs to be progressive, otherwise we lose the strength stimulus. So you need to look at how you can then challenge it further. And weights isn't very common. I confess I don't use them. I think I'm a bit nervous of using them, and perhaps I should use them more. But how can we do that? Can we put them in, you know, saddlebags, you know, in weighted jackets, or is there any other means of increasing resistance? But I think that needs to be done super carefully.
I think you hit on a point that's really, really important, is that it doesn't matter what interventions that you're using, there needs to be objectivity about it. We need to look, is it working? Where are we? Can we go further? You know, I think there's a terrible tendency to think that you plonk them on a medication or you plonk them on a supplement and that's it. There you go. That's done. Whereas any intervention that you choose to do, there is a timeline to be followed. You know, you're looking to see if it's working, and once it's worked, can it work better? And the same with physio, isn't it? So you guys work with objective measures, checking that your intervention is improving, don't you?
Yes, I guess the one we work with most is the quality of life, the health-related quality of life scale, the Vetmetrica, and I don't know whether Louise mentioned it. It's a questionnaire that's online that categorises, it slips my mind at the moment how they're categorised, where it looks at quality of life of the pet. And basically you can track the trend. So for osteoarthritis patients, you might get improvements, but don't be surprised if you get a dip as well. You might get a little relapse, and that's just the nature and pattern of osteoarthritis. The chances are you're going to get some small dips in your progress. But what's nice is that when you apply an intervention, you can also see the benefit of that intervention with those objective outcomes, those markers as well. So, you know, we get the owner to complete this questionnaire 24 hours before their appointment with us, and then we also have to answer a few questions after the consultation. Yeah. But the owner really, I think there's about 20 questions, if I've got that correct. And the owner's asked to respond to the question quickly. And then you might come to question 10 and it's been asked at question 2, but they flipped it on its head and they're asking it a different way. And so you're not allowed to think about it, but it just means the owner's realistic, you know, is answering honestly without thinking about it. And I think that's hugely valuable in these cases.
Yeah. And that's sad news, guys, though, is I got an email that they're absolutely overwhelmed at the moment, and they are doing the best that they can to start making it more available to the public, but at the moment they have got so many centres using it that they are maxed out. But we will keep you posted. Professor Jackie Reid is on the case. She knows it's being utilised and it's getting good results. In the meantime, there are others, you know, so there's the Canine Brief Pain Inventory, there's Load, there's Helsinki, there's client-specific outcome measures, and all of these can be downloaded off the internet for free, because no matter what you do, you've got to check it's working. And I will tell you a story. I saw a lady once and she was having acupuncture twice a month. And when I said to her, so how's it going? She went, yeah. I went, is it working? She went, I don't know. I was like, cool. You spend £110 a month and you don't know if it's working. She went, no, just get told to go back. I'm like, no. We need, for the sake of the animal, the sake of yourself, the sake of your pocket, the sake of the therapist, we need to be objective to make sure that our interventions are working, because we're all learning. Yeah. So we've hit 54 minutes and 45 seconds, which is amazing. Is there anything else that you're like, oh my God, I need to say this before we do 10 top tips?
Just looking at what I put to remind myself. Basically, I guess the value of hydrotherapy for weight loss.
Yes.
There's a paper, a 2011 paper, that looked at the use of underwater treadmill therapy for weight loss. If you've got a pet that's overweight and it's got sore joints, then certainly that if you've got something locally. So basically, put 8 dogs into a, I think it was a 12-week or 3-month program, weight loss program. So there was quite a large range for the median distance that they walked, but the median distance was 1 kilometre. Approximately 1 kilometre. The speed was about 1.9 kilometres per hour. But basically, they had 13 sessions, and I think 6 dogs completed it. 1 dog completed it over 2 months, and the other dog the other 5 dogs over 3 months. And what they found, there was 18.9% mean of 18.9% weight loss over that period, which is about 1.5% per month per week. I think it was. Yeah.
Which is amazing. That's target weight loss. That's what we dream of.
I mean, we don't know what accompanied that as well. Obviously, the owners were probably doing dietary changes at home as well, but certainly can help, hopefully, enhance that way or accelerate that way.
And I'm just going to butt in here. Cam follows. Can you see how clever this is? So Cam, it basically requests the support of lovely people like Diane, who are at the actual forefront of their discipline. They're using evidence-based, they're looking at research, they're making sure that they can clinically reason their decision making. So when they choose a therapy, when they choose an intervention, behind those eyes they're going, does this make clinical sense? Can I justify my decision? And this is really, really important, and we're going to hopefully have some guest speakers talking the importance of evidence-based, because that even applies to you guys that are just buying a product, buying a supplement off eBay. We all need to realize that there is a lot of work out there trying to guide us. We just need to open our eyes and use it. So thank you, Diane. That's a very good point you've made. Yes, 10 top tips. I'm sorry, I've got snot. Danny will know that I'm actually quite ill today, so right, 10 top tips. I'm going to start because it means that you will have to end with the big finale. Okay, so for all the Cam followers, 10 top tips is for us to distill some really take-home messages. And yes, they might be repetitive. Diane had said to me earlier, oh my God, I'm just going to say what other people said. Well, that's because it works. And if we kept loads and loads of other things, then you guys would get lost. Let's stick to what works and what is important. So I'm going to start number 10 and take the lead with the weight loss that Diane just talked about. We all say it. It's massively important. 9 out of 10 of you pet owners with overweight dogs can't see it. So step outside your comfort zone and get someone to give you their opinion. Your vet nurses, your vets, your local practice can do that for you. There's generally no charge. But if you really don't have access, then please join Holly's Army, because the lovely Lindsay is doing visual body condition scoring. It's not as good as touching, I must admit, but it certainly can help you in the right direction. So if you want to join Holly's Army, they can guide you on there, but you'll need a photo from above, looking down, and from the side, and then you send it to info@caninearthritis.co.uk, and Lindsay will help guide you. If not, Holly's Army will guide you. Please do it. Number 9.
Oh, we haven't touched upon it yet, but slip-free flooring, huge. And I know it's been said, but I just wanted to get in there now.
Yeah.
I think it's so important to minimise trauma to the joints. If you've got a dog that's slipping constantly around the home, and it's just going to compromise those joints, and
Yeah, it really is. And how long do you think you actually spend talking to your owners about home management in your hour and a half? Is it a significant proportion?
I would say 5 to 10 minutes at least. Yeah. It's very important because, you know, that's what the dog is faced with every day. And I know some pet owners think, oh gosh, you know, it's not aesthetically pleasing. It was brand new kitchen flooring, and what do I now do? But I can't, you know, say how important it is to minimise the trauma in those joints from slipping and sliding, and the jarring from slipping and sliding. So, yeah.
Perfect. I'm going to do a little follow-on that's a sneaky little addition to that. Number 8. And we're talking to an owner today, and it's about when the dog is quite vulnerable. And in my opinion, I don't really see any studies, but having been asleep for a period of time, you know, so it might be an overnight, they really are quite stiff. And things have gone numb, a bit dead, you know, they're trying to get things moving, get coordinated. Having them step off a bed onto a slippery floor at that point, to me, is absolute disaster. So really think strategically about your flooring and where they really, really need it. And that is a place that I think is really, really necessary. So bed, make sure that they are not too wobbly, they don't get lost in it, it doesn't become a massive trip hazard. Those plastic bowls, I hate them because you often see them clipping their legs as they're trying to get in and they fall on their face, disaster, and then they can't move, they get stuck in a horrible position. So think about the bedding, but also think about the flooring around that bedding. Very, very important. Your turn.
I guess, again, extending further on that, but looking at your thresholds into and out of the house. So again, you might get a dog that's inside and it's just at the doormat and it's a bit worried stepping out onto the decking, for example, or vice versa. It's outside on a, you know, a fairly abrasive surface, so it's got a good grip, but it's just worried about stepping into the tiled kitchen. So look at just placing simple doormats either side of door thresholds, or maybe laying down, if you're onto decking, laying down some false grass. That's really useful for outside. So just looking at door thresholds, because they've got to, as you said, step over that threshold, and they want to feel safe in doing it and knowing that they're not going to slip on the other side.
I'm going to do a little tag to that, because Cam's self-funded, and that made me absolutely die the other day, because someone said, you must be really wealthy by now. And I'm like, no, so far from the truth. We try and fund ourselves. We don't have any funding. You know, we have to be really careful to remain independent. So our anti-slip tape, our bandanas, our booklets, our practice training, that is the only way that money comes into Cam. So the anti-slip tape, which is a clear, colourless, gritty tape, is there to try and get people thinking, like Diane said, thresholds, white PVC thresholds, you know, conservatory doors, disaster. And I've got quite a few video clips that dogs that no longer can step over because they've got gait restriction or stride length restriction, and they perch their foot on that slippery plastic thing, and then it's disaster. But the good thing about the tape is it actually makes people start thinking about other things that they can do around the house. So please do look at the tape. Vets, therapists, nurses, think about stocking it, because it gets the ball rolling. You know, if they're going to put the tape down, they'll put a rug down. If they're going to put a rug down, they'll put a stairgate up. If they're going to put a stairgate up, they might as well, you know, restrict access to the level of the sofa. So think about it. Okay, number 6 for me, I love interactive feeders. And I love talking about them. Lovely lady today, again, talking about our little dynamic stabilizations and how she'd been shoving the dog across the floor. We combined that with a licky mat on a raised platform, and if the licky mat was there, the dog could stand quite square for a significant period of time. She could just do a little shunt, and she was like, oh my God, he's happy, I'm happy, everything's great. These interactive feeders are brilliant. You can use them for home therapeutic exercise. You can do them for distraction. They can make you feel better when you think you're having a bad day. They get the dog moving in little micro movements when they're in their bed, getting up in the morning. So this little dog was very stiff in the mornings, and we were like, right, come downstairs, get a licky mat, get a cot in there, get the dog beginning to move, and then they're going to start freeing up, and then they can walk away without hitting laminate. So number 6, interactive feeders. Think outside the box. Number 5 for you.
Just going back to 6, I had these on standby just in case you touch them. and a couple of books, brain games for dogs, and no walks, no worries. We have them on our desk for owners to have a little browse through and purchase. You can get them from Amazon. They're only a few pounds, but they have lots of little tips that you can do with your pet who can't exercise as much, you know, because of either osteoarthritis or they're post-surgery. So really nice books for owners to consult.
Dawn and Rosemary, maybe you'd want to contact them for competition prizes.
Number five. Ooh, minimize the amount of stairs activity your dog does, particularly if it's got arthritic elbows or carpus. The descent activity, the loading of those joints. If you remember the equation, force equals mass times acceleration, and your acceleration is going to increase going downhill or downstairs with the load of your dog, and it's increasing the forces on those joints. So just control stairs activity as best as you can, and that might be stair gate.
I love that. And make sure the stair gate actually does its job. I had somebody who, lovely guy, his dog jumped the stair gate and made it so much worse. So yeah, just make sure it's a good stair gate. Number 4 for me, harnesses. I recently wrote something for the practice that I'm working in about the importance of using things like the Help Them Up harness earlier than later. See it as a Zimmer frame rather than waiting for them to collapse and having it as no alternative. So I will put that on the Cam Pro page and people can use it in their own practices. They're fantastic. It's amazing. Do you use the Help Them Ups?
All the time. Yeah.
All the time. And they're not there as a salvage. They're there as the rebuild. And I think people are scared of seeing it. You know, this is a support to return function, stability, strength. But whilst they're slipping and falling and, you know, weak, you're just fighting. Don't be slow to embrace them. And if you are going to stop them in your practices, the orthopeds have been very lovely and they suggest that every one sold to a practice, they'll donate £2.50 to Cam. So if your practice starts stocking them, please mention Cam because we get a little bit of support for that. Number 3 for you.
Oh, I'm going to come down to exercise now. So just normal everyday exercise with your pet, little and often. And my biggest advice to pet owners when they're not sure what time their pet can achieve, I say to the pet owner, and this starts right from the assessment point, I say, does your pet get back from exercise, has a half-hour rest, then get up stiff and looking more sore? If that is the case, the exercise was too long and too much for your pet and you need to draw it back. But if it's recovered fine and it's walking normally after that half an hour of rest period, then it's a good level and you can start gradually increasing that. So that's why I always advise owners on how to progress their normal everyday aerobic exercise.
Love that. Very practical. And tagging onto that and doing an unashamed post advertising something else that Cam does. You can see it behind me, these bandanas. They're so important. When you hear about the stories that people have these dogs that are a little bit frail, they aren't able to turn on a sixpence anymore, they can't propel themselves out of a dangerous situation, they're fragile, and they've got a 2-ton Labrador coming towards them at high speed across the park because somebody else hasn't got their dog under control, and that dog's really friendly. And that poor little older dog tries to walk backwards or avoid, and they stumble and they trip. These bandanas can be really, really helpful for owners of dogs that need to have a bit of a wide berth, a bit of understanding. I used it a lot for Holly because she was quite debilitated at the end and I didn't want people judging me. And I know that sounds daft, but for me, her wearing that said to the world, I know, and I've got it under control and I am intervening, and please, you know, be assured that everything's fine. Because there's nothing worse when somebody walks past and they stare at you as if to say, oh my God, really? And the other thing is brilliant in the pubs. So if you're in a pub and your dog's wearing a bandana, they give a wide berth, and you can have your beer in silence and no one disturbed. So number 2. Finally, number 1 for you.
Oh, well, I think we've covered most of the core treatments for osteoarthritis, but I targeted specific strengthening exercises, I think, and finding somebody that can help you create that, even if it's just a one-off consultation, who can help you with that. It will make a massive difference to maintaining strength, minimizing pain, improving function and having a happy and healthy pet longer.
I really believe in that too. And Danny was, as I say, here last week, and I was really pleased that we've got a dog on our books called Willow, who's a 6-month-old dog with really severe elbow dysplasia and really bad hips. And the dysfunction coming down from the hips have led to hock hyperextension and just terrible. You know when you went, no. And the lady's now started doing her home therapeutic exercise plan, and in a week, we've seen massive progress. It is quite profound, and I think people need to kind of like have their eyes open to it. So thank you for that. It's very important. Thank you so much, Diane. I'm sure there will be loads of questions. I will keep an eye on this, and if there's any questions I can't answer, I will get in touch with you. I'd like all the CAM followers to say a massive thank you. We would always love Diane to come back. She's got so much knowledge, and I think it will really help you guys out. But thank you for your time.
Thank you for having me.
It's been amazing. And it's almost like they're silent because they're so wowed.
Hopefully they've taken home some useful information. So
I think they have. Awesome. Thank you, Diane. Until next week, as I say, February the 12th, I have got a bit of a hero here. She's a bit of a hero of yours as well, isn't she? Ed Hughes brings wit and humour and practicality. She lectures all around the world. I'm so grateful for giving us her time to come and have a chat with you. If you miss it, you're stupid, because it will be fantastic.
No, a big shout out for Laurie. Please, if you've got time to watch her, she is just brilliant. So yeah.
She is brilliant. Cool. Thanks, Diane. Until next time.
See you later. Bye. Bye, followers.